Good afternoon, everybody. Welcome to Berry University Review Week sessions. My name is Dr. Papadakis. I'm an assistant professor at Sport Exercise Sciences. I'm the director of the Human Performance Laboratory, and also I'm the director of both the undergraduate and graduate exercise physiology programs. Today, I'll be your host, and together we're going to be touring the Human Performance Laboratory and also the Motion Analysis Center Lab. We're going to have also a chance to meet with some of our students.
Hi everyone, my name is Melissa. I'm a fourth year student in the exercise physiology program at Berry. I started coming here a few years ago as a transfer from University of Miami. During this experience, I've really loved being here at Berry. It's very hands-on. The class sizes are small, so you get a lot of experience. The professors are very helpful and appreciative, and they're always available, sometimes even not during class hours, which is really great. And the experiment that we did earlier this week assessed mental toughness and exercise and their relationship. So we asked people about how much they exercised before COVID and how much they exercise now. A couple of questions about self-compassion, a couple of questions about mental toughness, and then we did some basic assessments on body composition and upper body strength to see how the data related to what their assessment results are and what their mental toughness results were.
My name is Kendrick Morris. I am a graduating master's student here at Berry in the Human Performance and Wellness program. My research is focusing on qualifying the sensory motor profile as well as the physiological profile of esports gamers compared to traditional athletes and non-athletes, non-gamers. So essentially we're trying to qualify whether or not esports is the correct term to use or whether or not those gamers are in fact athletes. I chose Berry primarily because of locality, being I live in Miami and I work in Miami now. But it's been an experience here. I've definitely valued the smaller class sizes coming from a larger campus as well. I appreciate the accessibility to the professors as well as other opportunities in terms of research. And a lot of the different opportunities that are here. I'm also one of the Sports Exercise Science Scholarship awardees from this past year, so that's definitely been something to value as well. So if you're looking into this program, it's definitely something to take advantage of in terms of opportunity.
Thank you so much, Kendrick.
Hi everyone, I'm all good. My name is Michelle. I'm also a fourth year undergrad student. I'm an exercise physiology major. Berry have given me a lot. I'm also a rower here. I'm part of the rowing team. And you have a bunch of athletic opportunities, academic opportunities. Specifically in this major, you have a lot of research opportunities, either with Dr. AMASAY or with Dr. Papadakis. There is always trying to get us involved in different research studies. In the past, I've been working in a study with Dr. AMASAY about muscle imbalances in nursing and PA students who have really long shifts of work, like 12 hours in a row. So we're using some sensors that we collect like in their neck and in the lower back to see how much time they are bending and how much they need to use their muscles during the day, and this is provoking muscle imbalances in them. Here the BIODEX system, this is mainly used to measure isolated muscle strength, muscle power, the speed also, range of motion, and the torque in each of your joints, mainly hips and knees. And we have used this in the past to measure, like for injury prevention, research related, or to measure in different athletes the amount of force that they will need for a specific sport.
So this is called the COSMED. The COSMED is a metabolic cart. Metabolic carts are used to measure respiratory gases like carbon dioxide and oxygen. You can also use this to measure lactate. If you're testing individual, you can also use this to measure their VO2. And here we have these masks that we use to put on our client. And here we have electrodes for ECG because this machine can also do ECG. And then we have things like blood pressure cuffs and things of that nature because you always have to take those levels whenever you're working with a client. And over here, we also have an EKG machine, and as you can see, this will measure heart rate. And this is something really important for when you're doing testing with clients as well, because you want to make sure that their heart rates are within appropriate levels so they're not in danger. And then if we move over here, back to Michelle.
A kayak simulator, it could be used to measure, for example, I'm a rower, as I said before, so I'm thinking of doing a study to measure like the different angles to prevent back injuries, mainly lower back injuries. So you could use this to simulate either a kayak movement or a rowing movement too, because it's a similar back and forward cycle. So this tank is also used to measure body composition. So basically the person or the athlete who is going to be tested goes inside, water covers, and then after a while it's going to give you body fat percentage, bone mass, muscle mass, and all those factors of body.
Oh my goodness, this is so cool.
Yep, super cool.
So we have all these bikes here that we use for the VO2 max testing or any endurance tests.
And treadmills as well.
Treadmill as well, depending on the protocol, we use different equipment. And the butt pad is also a really good system to measure body composition, but this one, instead of liquid or water, it uses air displacement and the body density of the human body. Yes, so in our body, we need to go outside. We're gonna see some athletes.
So now we see here the basketball team doing their workouts during COVID. Almost there.
Yeah, here in the world we have all the athletes with NCAA championships.
Yes, Barry has very good sports teams.
So finally, BIOMECHANICAL.
Melissa.
Okay, so I started out in Barry's athletic training program, which is an amazing program. It's very hands-on. You get to work with a lot of athletes and spend a lot of time in the athletic training room, working with them before games, after games, when they're coming in for training, but maybe they need to get wrapped first, or coming in after training and maybe they need to get iced or take a hot shower or a cold plunge, whatever the case may be. And now I'm in the exercise physiology program, which is also very hands-on. We work a lot with athletes as well, and it's been a great experience. I really like it. It's a wonderful program. They have amazing opportunities, and if you're looking for a place to go, you should definitely come here. Seeing someone take blood pressure versus doing it yourself is a very different experience, so the hands-on is essential for anybody who wants to be in the exercise medicine profession. So I'm doing my internship in cardiac and pulmonary rehabilitation, and I'm excited about that, so I think that I might go into a hospital or some type of a clinical route when I graduate.
There he is.
Here we
Okay.
go. Hi, Dr. Amasay. How are you?
So this is
So I'm responsible for the MAC lab. This is the biomechanics lab. We do a lot of mechanical analysis, the basics of the body movement. As you can see, we have 8 cameras around here. Those are infrared cameras that we have. Those cameras are collecting body position. We use those small reflectors. We put it on a specific part of the bodies, such as the thigh, for example, the leg, the shank. You can put it on your ASIS. And what we get from that, we get the position of each segment of the body, and that gives us, from there we can calculate 3D motion of the body, angles. You can think about all the movies, like you see Avatar and all those other movies, same way. We don't get the same details then because we're working on the scientific portion. So we can use that to get how fast the segment moves. For example, we can look at a soccer kick, a baseball throw. We can look at acceleration of different segments of the body, coordination. We have 2 force plates here. Those measure the forces you exert on the floor. For example, while jumping and landing, running, walking. We can do push-up. There's a lot of other aspects you can use here. We have a treadmill. When individuals want to measure running, walking on a treadmill, look at corrective body positioning. We do that now in some of my studies. We work on shoulder mobility with the upper quarter Y balance test. So we have individuals in push-up position and they reach to different directions, and we measure forces and mobility. We look at hip position, range of motion, internal, external. And we work also at the HPA lab, you see, with the ISOKINETIC machine. We're measuring relation between different muscles, such as quadriceps femoris and hamstrings. We're looking at gluteus medius and the adductor magnus. Those are the concepts we do here. We have also EMG. It's there, and we can measure muscle activity. So you can have, for example, we had one of our students do work with one of the ballet company here at Miami, and they measure the difference between new point shoe, an old point shoe, a dead point shoe, and they measure forces, they measure 3D kinematics, movement, angles, and they also measure muscle activation. So this is the system we're working with.
Oh, this is so cool.
Yeah, and you can see a lot of stuff. And I mean, for example, if we have, Michelle, can you jump on the force plate? Hold it for a second. Let's see, if I put it on a force plate, for example, you can see the forces here. Let me just make it bigger. So you can see the forces on the force plate. Can you jump? So she left the ground, no forces, and then she landed. This is the offline. This is the study my students did. The individual did arabesque, and you can see there's the lower leg, and you can rotate, and I can see from different position how it looks.
That's so cool.
And you can see we're working with coordinate system, X, Y, Z at each segment of the body. And we can make it closer or further away. And you can see all the cameras that we work around here. So that's some of the aspects. I can move also for a graph. And let's see if we can see. Yeah, we can see it now. Some of my students, the one we currently, she is now at, oh, I forgot the name, Waterloo. Waterloo in Canada. She is on a full ride scholarship there. She worked with me on corrective exercise techniques. We worked on lower extremity. We looked at internal, external rotation of the body. She was also my GA, so she assisted me with the upper quarter Y balance testing shoulder movement. She presented her work in the American College of Sports Medicine, which is an international conference. I have a lot of other students working with me, undergraduate students that went to I also a graduate student that did the ballerina one. She just finished. She is a doctor of physical therapy. And then I have also, Michelle is working with me on a study we're doing with nursing students and physician assistant. We are measuring their movement of work with accelerometers during their day when they do their assessment and clinical in physicians' offices, hospitals, etc. And we'll compare between the two individuals. So muscle disorders and burnout of those students. So there's a lot of opportunities. My students and Dr. Papadakis' students are going towards presentation in national and regional conferences such as Texas Conference and Northeast. We already have several studies that we are going to present during this year. Well, specifically with graduate students, we have a lot of opportunities for the students. It's a lot of hands-on experience. You can come to the lab even as an undergraduate student. You can come, you can work with us as faculty, and we share our research with you, and we can work and do things together, and you can learn a lot. We support you, so at that point you can get a lot of opportunities when you want to graduate. As undergraduate, for example, I teach also strength and conditioning classes. And our students will have a lot of hands-on activity. They go and work with, in Bolorito, for example, physical therapy, scenarios, chiropractic schools. They work in athletics. They work with professional players. Melissa and Michelle, for example, both of them still working in those places.
In ADAPT.
In ADAPT, which is personal training. So there's a lot of hands-on opportunity. So when you come to Barry and you work with us, you can get the best experience you can ever have, specifically at South Miami, South Florida. South Florida, you have a lot of athletics, a lot of sports. As a result of that, of course, you have a lot of clinical aspect, rehabilitation, physical therapy, and chiropractic. And you can get a lot of experience. We have a lot of good connection here. And I had about last semester, one of my students graduated also from a DPT school, and he came and say hello. We have another one that just finished chiropractic school, and she opened her own place, so we'll do an agreement with her so our students can go and work. We have also occupational therapy that students can go and work in occupational therapy. And So there's a lot of opportunities which you might not get and get lost in a bigger university, whereas here at Barry it's a smaller, but besides that, it's the location and the faculty that you have that will do everything they can to help you reach wherever you need to.
Please follow us on social media at Instagram, zpapadakis, Twitter, Zach Papadakis, and Facebook at Barry USCS. We hope that you had a wonderful time with us during our facilities, and also we wish you all the best and would love to see you joining our program. Thank you so much. Have a wonderful day. Go Bucks!